Before we get started, let's be sure everyone is able to select their language channel. The options available for the sessions are English, Spanish, or original audio if you would like to hear the audio without interpretation. For people connecting through a computer, you can choose your language channel by clicking on the interpretation icon to the bottom left that looks like a globe. For people connecting with a mobile device, you can choose your language channel by selecting the More option, then Interpretation, then select your language from the available options. Extending so much gratitude to our interpreters today. We also have live captioning available that can be accessed by clicking on the multimedia viewer box at the right of your screen. Now we will begin. Hello, and thank you for joining us today for the 5th session in our series, Accessible, Culturally Responsive, and Trauma-Informed Advocacy Across the Lifespan. My name is Carla Alegria. I use she, her pronouns, and I am the project manager of the National Center on Domestic Violence, Trauma, and Mental Health. It's my pleasure to introduce today's session, a tool that is applicable to all stages and in honor of Mental Health Awareness Month, supporting survivors' well-being. Today's webinar is presented by Tori Weinkoop, our Training and Technical Assistance Manager. Now, for some troubleshooting tips about this platform. If you get disconnected from today's session at any point, please re-enter the session using the original webinar link that was emailed to you. If the sound is unclear, it is likely due to an unstable internet connection. If this happens to you, feel free to call in for better audio connection. If you're experiencing technical difficulties, you can directly chat with me for assistance. And if you're unable to contact me, please reach out to WebEx tech support. I will post that phone number in the chat box shortly. We welcome you to use the chat feature to share thoughts, questions, and resources throughout the session. Your screen may look a little different depending on what kind of device you're using. Usually the chat box can be found at the bottom right of the screen. You may have to click on the chat icon that looks like a speech bubble to open it. Let's test this chat feature now. Please introduce yourself in the chat and let us know where you're joining us from today. Excellent. Thank you so much. Our center is headquartered in Chicago, the unceded homelands of the Council of the Three Fires, the Ottawa, the Ojibwe, and the Potawatomi nations. We invite each person to learn about the land you are connected to. One resource to get started is the website native-land.ca. I will now welcome Tori to the virtual stage.
Hello, everyone, and thank you for the introduction, Carla. I'm going to go ahead and share my screen. So for today's session, this is on Mental Health Awareness Month and supporting survivors' well-being. As Carla mentioned, my name is Tori. I am the Training and Technical Assistance Manager. And while I reside in Chicago currently, I am originally from the Spokane Tribe Indian Reservation, which is in eastern Washington state. I am a tribal member of the Spokane Tribe and also a descendant of the Coeur d'Alene and Colville tribes. The National Center is a special resource center that is dedicated to addressing the intersections of domestic violence, trauma, substance use, and mental health. Here at the center, we have 4 focus areas that include training and technical assistance, research and evaluation, policy development and analysis, and public awareness. I want us to draw our attention to the image that is here on the right-hand side of the screen. This is the center's framework, the accessible, culturally responsive, trauma-informed approach. And on this outer ring of the circle, we have the key perspectives that include human rights and social justice, cultural, historical, and community context, domestic and sexual violence advocacy, and a trauma-informed approach. And these four key perspectives help inform the core principles that are found here in the inner circle that include a survivor-defined approach, physical and emotional safety, hope and resilience, and relationship and connection. And it is through today's session that we will see a lot of these themes pop up when we are discussing the well-being of survivors and how our activity and discussion today around pod mapping can further this framework and approach within our advocacy work. So before I move forward, I'm going to stop my screen really quick because I want to be able to see the chat for a minute. And I'm going to share an excerpt from Braiding Sweetgrass, Indigenous Wisdom, Scientific Knowledge, and the Teaching of Plants, which is by Robin Wall Kimmerer. So it's this book. And I will be referring to the chapter called The Three Sisters. So Native people speak of this gardening style as the Three Sisters. There are many stories of how they came to be, but they all share the understanding of these plants as women, as sisters. Some stories tell of a long winter when the people were dropping from hunger. Three beautiful women came to their dwellings on a snowy night. One was a tall woman dressed all in yellow with long flowing hair. The second wore green, and the third was robed in orange. The three came inside to shelter by the fire. Food was scarce, but the visiting strangers were fed generously, sharing in the little that the people had left. In gratitude for their generosity, the three sisters revealed their true identities: corn, beans, and squash, and gave themselves to the people in a bundle of seeds so that they might never go hungry again. At the height of the summer, when the days are long and bright and the thunderers come to soak the ground, the lessons of reciprocity are written clearly in a Three Sisters garden. You can tell they are sisters. One twines easily around the other in relaxed embrace, while the sweet baby sister lolls at their feet, close but not too close, cooperating, not competing. Seems to me I've seen this before in human families, in the interplay of sisters. After all, there are three girls in my family. The firstborn girl knows that she is clearly in charge, tall and direct, upright and efficient. She creates the template for everyone else to follow. That's the corn sister. There's not room for more than one corn woman in the same house, so the middle sister is likely to adapt in different ways. This bean girl learns to be flexible, adaptable, to find a way around the dominant structure to get the light that she needs. The sweet baby sister is free to choose a different path, as expectations have already been fulfilled. Well grounded, she has nothing to prove and finds her own way, a way that contributes to the good of the whole. Now, as we move forward within today's session, I want us to keep in mind the analogy or metaphor that is present within the Three Sisters story when we talk about pods and pod mapping. I want to give us brief definitions of the difference of what a pod is and pod mapping. So a pod is a group of people who one would turn to for different kinds of support. Different kinds of pods for different needs can be found within our own pod maps. And pod mapping is a tool for identifying and cultivating one's pods of support. The origins of pod mapping come from Mia Mingus and the Bay Area Transformative Justice Collective. Mia Mingus is a writer, educator, and organizer for disability justice and transformative justice. Transformative justice understands harm as rooted in oppression and seeks to cultivate safety, well-being, accountability, and accountability through connection and transformation of the conditions that perpetrate harm. When this pod mapping was first thought of or first coming to fruition, the concept of community was a difficult term to use because many did not know what it meant. Others defined it in very broad ways, and others did not feel connected to community. There are also many definitions associated with community, viewing it as a large number of people or a set of values that ground social norms. Community was also a challenging term, especially when individuals experienced harm and abuse within their communities, or when survivors would come forward with the harm they've experienced. The community could turn against them due to patriarchy, violence, lateral violence, etc. A new term was needed, and thus PODS was created. It was more specific in understanding that survivors and individuals who experienced harm would be more likely to reach out to trusted individuals before institutions such as social services or law enforcement. The term pods help us zoom in on the trusted relationships that are built and how, through pod mapping, we can see an overview of what community looks like for each of us and who we can turn to when we experience harm and violence. Now, I want to open this up to the group, to everyone who's in today's audience, and ask, how could pod mapping support survivors and their families? So please go ahead and respond in the chat, and I will put this question in the chat so I can see the responses. All right, so the question is in the chat. Yeah, I'm seeing some really great responses. Some of the themes that I see pop up is about identifying support systems who may have similar experiences, or being able to untangle seeing supports, especially if we are experiencing crisis. And it can help us increase connection to resources that are both formal and informal, and looking at ways that this can increase community support. Pod mapping helps increase safety and support. Emergency safety planning, another conversation around informal supports. yeah, may feel more realistic to survivors in terms of what resources they would access in a time of need. So, what would be the difference between informal supports and formal supports? Yeah. So, I'm seeing informal supports are not tied to bigger systems such as legal, child welfare, other forms of social services. Formal supports could be established organizations, informal could be family and friends. Mhm. Yeah, I'm very glad you are all able to identify the differences between formal and informal. Um, Even though I wouldn't consider informal supports to be informal, they're just as important, if not the most important for survivors. Yeah, okay. I'm gonna share my screen again. And thinking about the elements of pod maps and how these can support survivors and their families, I want us to look at how the elements are arranged when we are looking at pod mapping. So if you see here on this image, in the middle, we have you, or I could put myself. And when you're doing this activity, you can put your name if you want. And what you are doing is you're going to draw out additional circles around your name, and these will be your pods. And these pods represent the people that are closest to you and who you'd reach out to first. So, for example, for myself, I would have Tori in the middle, and then my pods would include my mom, my grandma, my cousin, my sister, and one of my friends. When we extend our map out to include dotted circles outside of our pods, these represent maybe people that you need to build trust with and deepen relationship with, or these could be individuals that you go to for support if anyone in your direct pod link are not available. And so essentially they are movable. These individuals, maybe even systems, are movable to where they can be in the inner circle, but then other times they would be in this outer middle circle. And our last layer for pod mapping includes what you can access in your local area. So this would be resources. This could be networks, and these can be organizations and groups. And so for myself, if I think about where I'm located in Chicago, I would think about what are the resources that I have that are geared towards Native Americans. We have the American Indian Center. We have an American Indian Health Service clinic. Um, and there's also additional supports that I could reach out to in terms of counseling or maybe even support groups that I would like to attend. For pod mapping, it may not always be the same. As we move throughout our lives, at one point in your life. You could feel like the people in your pods are the people you're always going to go to. But as we go through life, that could change. So just having the understanding that our pod mapping is not always going to look the same as we go back and reflect. So if we went back, if I did this now and then reflect on this a year later, it's possible my pods are different or my movable pods are different depending on who I'm interacting with at that time of my life. Um, and that's just something I want us to remind ourselves and not feel like we have to stick to these support systems if they're no longer serving us in our best interests. So I'm going to turn this over to Carla so that she is able to share this video on pod mapping and a demo of it.
Thanks, Tori. Make this big.
Imagine pods are relationships with people that you can turn to for support during times of crisis. A pod mapping exercise is an opportunity for you to identify the individuals and groups that make up your support system. In this exercise, you are the center circle. Imagine something were to happen to you, physical or emotional. In a crisis, sometimes it feels like we're all alone. But then we add in your first layer of pods. These are relationships with people that you know that you can trust. These might be family members, your very best friend, your boss or coworkers, your therapist or pastor. These are your go-to people in a moment of crisis. This exercise works best if you get specific. Name these people in your life directly. The next layer of pods are dotted lines because they're considered movable relationships. People that could be moved into purple circles with a little more work. What could fill that role if your first pod people are not available? These could be extended family members, neighbors, doctors, church folk, budding relationships with people you could build trust. For the last layer, consider institutions that could be able to help you. This could be a faith community, book club, your school or sorority, a nonprofit that you have connections with, maybe a neighborhood association, or a hotline that you can call. These can be local or national organizations that you can call upon if you need them. Pod mapping reminds us that we aren't alone. What started as a single circle has become a network of community support. Look at all the resources available to you that can uplift you during hard times. Now that you've identified your community, reach out to the people in your pod and start a conversation about what it looks like to provide and receive support.
Before we were using Monday.
All right, thank you for sharing, Carla. Hopefully everyone could hear and see that. I was able to hear and see that on my end. I just want to reflect on how pod mapping can support survivors' well-being. And specifically, I want us to think about this when we have our initial contacts with survivors, and if we're safety planning with survivors. I think a really great thing about pod mapping is its ability to really emphasize that the survivor is the expert in their lives. They're the ones that are able to identify the individuals who are most supportive, and they would feel the most comfortable reaching out to, the individuals that they are connected with and trust the most. Another great thing about pod mapping is that you can utilize this information and really have conversations with the survivor and how this supports not only safety during crises, but also ways to stay engaged and provide that support that is hopeful and resilience and really relationship oriented, and providing, and within, by providing that relationship, help fostering hope and resiliency within ourselves, within our families, and within our communities. An example I have is that when I was working as a domestic violence advocate on my reservation, many times when I would do safety planning with many of the individuals that came through, they oftentimes had difficulty conceptualizing safety outside of their own being and how they keep safe within a household if they are experiencing abuse. And so by having this pod mapping exercise, it broadens their perspective of how to do a safety plan without giving the power back to the person who's abusive, and finding ways to connect with others when they need that connection and relationship. And what I mean by giving back power to the individual who's abusive is, for instance, if a survivor has experienced any sort of mental health crises, that can be easily used against them. And so when they're experiencing mental health crises, we don't want to put in the safety plan that we want the abusive partner to be there to support them, because again, that can be weaponized either in that moment or later on. So what we want to do is really put this groundwork into, how do I find these support systems when I'm having these crises, and how do I think about these forms of support in moments of when I'm calm and want to think about how to work through these different scenarios. And so this simple pod mapping exercise is really a great way to develop a sense of where the survivor is at, and really building rapport with them as well. Pod mapping is also a great way for ourselves as advocates to identify advocates and staff who work with domestic violence survivors, to identify the different ways of who we can turn to for supports, who we can turn to outside of our support systems, and who we can turn to in terms of organizational support. And through this pod mapping for ourselves, it gives us an opportunity to really understand how we can continue supporting ourselves so that we're able to continue refilling our cup and being effective when we work with survivors. So I want us to look at this pod mapping template. And we have the resource here of where it comes from with the, actually, I'm going to put this in the chat as well, with where you can access it. Sorry. Okay, here we go. So here is the link to where you can access this PodMap template. And don't worry if you're not able to print it out or anything. You can do a pod mapping exercise on just a blank piece of paper and draw out the web or lines in any way that you like. I'm looking at the Okay, so yeah, what I want us to do is to go ahead and try it for ourselves. So I have my piece of paper here and my pen. And I'm going to start off by drawing a circle in the middle of my paper and putting my name in it. Or you can also do what this template shows and just write a line, and on that line, write your name on it. And with our names, I want us to think about who is in our pod and write their names in the bold circles around your name. And then we have the bubbles with dotted lines around your pods, who are the people who could be part of your pod if you built more trust or relationship with them. And then you have the large circles on the outer edge for larger groups that could be a resource for you. So this could be hotlines, this could be peer support networks. And so I'm going to leave this slide up for us for now and give us about 5 to 10 minutes to do our own pod mapping. And then we'll come back together and share our, if you want to, share our pods together. Okay, go ahead and keep drawing your pod maps. I'm just going to share what I've done so far. And so with these pod maps, I wanted to go back and really highlight the story that I spoke about earlier with the three sisters, which include the squash, the bean, and the corn, and how they essentially help each other grow, but they also have their different ways of supporting one another. And so what I did was I drew corn in the center because with corn, it described the corn sister as being the one that essentially blazes the trail for everyone. And I put her pods as the bean, the squash, soil, and the planter. And then her movable pods as the bean cousin, which I'll explain in a minute, corn cousin, and additional family plants, which can include anything really that provides support to the corn. And the organizational resources that I included was farmland, acres, acreages, bug colonies that can help keep the plants healthy, and the head farmer who makes all the calls of how and when they will be put into the soil. And so that is the pod mapping for this piece of corn. But if you look closely, the movable pod that I included was the corn cousin. And within this corn cousin, they have pods that share with other beans and planters and soil. And so I really wanted to use the three sisters as a way to show that while we can do our pod mappings and demonstrate all the ways that we connect with our pods and other movable pods in those outer circles, our own pods also have people that they trust and that they would go to in times of needed support. And that's just to demonstrate that while the term community initially within this project was a bit difficult to define or describe, the pods help us see at like a molecular level or like at a zoomed in level that individually we're all connected. And when you look at all the ways we're connected, it forms a community. And so looking at all the ways of how we are present for each other, how we show up for one another, what our roles are, and how that can look different within each pod and within our own pods. So that's something that I want us to keep in mind. And also understanding that all of our pods are going to look different. So maybe the corn cousin doesn't have a sister squash, and it's just this corn cousin with her sister bean, right? I know this might feel like a weird analogy, but what I'm trying to say is all our pods are going to look differently, and all the ways that survivors are connecting with others are going to look different because of the unique life experiences that they all have. And this is also to say for us as advocates as well, in terms of our pods are not going to look the same as one another, nor are they going to look the same if we do these again in a year from now, because as human beings, we're constantly changing, constantly learning new things. And so I want to open this up for anyone who wants to share possibly who they put in their pod, like their direct pod, if you feel comfortable letting us know. Yeah. Nuclear family director, so coworker. Partner and closest friends. I see therapist. Yeah, our pods. I think there's always this assumption that with our pods, our closest connections are going to be with family and friends. But that's not always true because it's quite possible that it's within our family dynamics where we're experiencing this violence or domestic violence. And so we find other support systems with individuals that we may relate to or are able to provide that support that we need. Yeah, so having to do with what kind of support I need. Exactly. Your pods are going to look different in that way as well. We all have different needs, and the way that we connect with someone depends on whether or not those needs in those moments can be met with support. Yes, pets are also a great pod member to put in. I also use my pets as companions to go to when I feel stressed, mainly because they'll unconditionally love me. One thing that I wanted to know, please continue sharing in the chat. I love reading all of these. One thing I wanted to know is that when we think about supporting survivors' well-being, someone already mentioned it, but it does depend on the type of support we need. So when we think about this in terms of Mental Health Awareness Month, what kind of resources are there in terms of the big circles? What are our movable parts, and who are our direct pod contacts? And this could be different if we think about this in this context of like maybe not even so much self-care, but if we think about it in the context of substance use. So if we're working with survivor who wants to be able to either continue on their journey of recovery or to find ways to use safely without the interference of their partner. And what ways would this pod look different when it's the topic of substance use versus a pod map that focuses on mental health, and how both can give, how both maps will always give the survivor a means of being able to really have their own agency and sovereignty and control over their decisions and who they're going to trust with these conversations. I see peer support groups. Yep. A treatment center, swimming and camping. Yeah, it doesn't have to be a person. It can be things that you enjoy doing. So within your pods, for instance, if I put myself, I could put my mom and my grandma. But what if they're not available? So what else besides the movable pod section can I do to help myself in that moment? Well, I can think of either self-care or coping strategies such as going for a walk or, drawing. And thinking about all these ways that we have these movable parts and how we can insert them, remove them to ensure that in the moment that we are experiencing stress or crises, we have our own toolkit to go back to and refer to, whether that's a person or something that we enjoy doing. I also see reading a book, nature, yeah. This is great. I really love how we moved from individuals within our pods to other tangible items, such as, the way we can move our bodies to help mitigate these feelings of feeling overwhelmed. Yeah. And this is also really important to talk with survivors with as well. If they feel like they don't have anyone to turn to, who or what are they able to turn to in that moment so they're able to try to gain that rebalance, um, or regain that sense of control within themselves if they're feeling a crisis come up, or if it's a crisis with, a partner who's being abusive, continuing to use the POB map to extend out and really use those resources that are either available within our moving pods or within our resource pods. Just really understanding that these pod maps can, as I've reiterated time and time again throughout the session, can look very different. So we are coming up with about 10 minutes left. And what I want us to end with is looking at these additional resources. So we have these pod mapping resources. And with these pod mapping resources, we have pods, the building blocks of transformative justice and collective care by Mia Mingus. So you can gather a little bit more history around the concept of pod mapping and how it came to fruition. We also have the pods and pod mapping worksheet by Mia Mingus, and also how this pod mapping exercise has been used by the Southeast Asian Diaspora Project, which is available in several different languages, such as English, Burmese, Hmong, Khmer, Lao, and Vietnamese. So before I have us leave, I want to ask if there are any questions or comments. I do believe that the presentation, is it the presentation that will be shared, Carla, or the slides?
Yeah, so in about a week or hopefully a little bit before that, we'll share the recording link, the slides, all the handouts, and an evaluation link in an email, a follow-up email.
And I see a question that asks, when we do this with the survivor, do they get to take it with them? It depends on their life circumstances, and definitely a conversation you want to have with them. Do they feel comfortable and safe taking that back with them into their own household? Do they need to give it to someone else for safekeeping? Or is there a way to keep it within your organization that is kept confidential? So really going with what the survivor wants and needs and how they define safety in terms of doing this pod mapping, and ensuring that overall the abusive partner does not get a hold of it. So how would they like to do that? So again, their journey. Will we get certificates of attendance? Carla says yes. Oh, I'm so glad everyone loved today's information. Yeah, I really enjoy using pod mapping as well. It definitely reminds me of another activity that we do here at the center called the cultural pie, and that how we identify is always going to change, and in the ways we identify informs who we go to for supports. All right. Well, thank you everyone for joining today. Oh, wait, let me put up the slide that says thank you. Thank you for joining us today.
Thank you, Tori.
Yeah.
Thank you to our interpreters. Thank you to staff who have supported this webinar. And thank you to everyone who attended today. As I said, in a week's time, you'll get a follow-up email with the recording link, the certificate, the evaluation link, and the slides and handouts. If you have time now, I've added the evaluation link in our chat, and if you could fill it out, we would be really grateful. Thank you, everyone. We hope you have a wonderful afternoon.